Well, I'm Trudy Sheree. I'm the Chief Sales Officer for CSI Dry Eye Software. And as Dr. Matosia mentioned, we are an AI platform. So artificial intelligence, first of its kind software, management software for dry eye. Before I kind of dive into why you should consider this impressive platform, I'll tell you that we use evidence-based algorithms to really look at the root causes of dry eye and the associations of dry eye. So before we get into why use the software and a little bit about the software, let's talk about why dry eye is so confusing and challenging. So next slide, please. So I'm going to start by saying dry eye can be very challenging. As you know, it's multifactorial and complex. There's a lot of reasons why somebody may have dry eye. So we have to get to one of the root causes of why dry eye and really look at the data to try to interpret what is causing their dry eye. So it can be complex. Next slide. As you can tell already, just by some of the protocols that are out there, this is the Asker's algorithm and protocol. You're all probably familiar with the DEWS-2 study, soon to be DEWS-3 study, and just the complexity of the algorithms. Not only, as we start to look at what is causing the dry eye, what do we do next? Where do we go next? What is our next step once we start to see that? So next slide, please. Dry eye can be confusing. As you can see, the landscape around dry eye disease is ever evolving. So the diagnostics that are available today, you just learned a little bit about the new technology from eSwin. Everything from the equipment and the testing that's available to some of the therapeutics and even, so many FDA-approved products and drops. Where do you go when you start to understand what type of dry eye it is? And then, of course, the treatments that are available, from IPL to RF to low-level light to lid hygienes, the different home therapies that are now available. Where do you go in your treatment protocols? And so next slide, please. Welcome to CSI Dry Eye Software, the first of its kind AI for dry eye. It's going to do numerous things to help manage your dry eye clinic. And so think almost like an EMR for dry eye. When we start to show practitioners, they're so impressed with how detailed and thorough this platform and software is. And I'm going to tell you a little bit about the inventor. But it does so many things to help manage the data for your dry eye patient, to really interpret that data, help you understand the type and severity of the dry eye, and then, of course, build a treatment plan specific and personalized to that patient. So before we move on, let's just run through this really quickly of what this software can do. So first off, when you enter a patient into the software, it starts to kick off algorithms. It's understanding where that patient is in the environment that they're in. So looking at everything from the temperature and the humidity, and understanding, their personal information from their age to their gender, and then of course some of their medical information pertinent to dry eye that we're going to pull into the assessments to truly understand what's causing some of these root causes of dry eye. And we're also even going to look at the medications that a patient's on. This is proprietary to our software. And we actually red flag any medications that are causing dry eye, so the practitioners can immediately see, some of those meds that could be, having some of those issues. And then, of course, adding that into the assessment to help us with that interpretation. We're also sending out digitally some of those dry eye questionnaires like SPEED, OSDI, DEQ, and having them come back digitally when the patient fills it out into the software, where we can now integrate it right into that assessment, making it efficient, fast, effective for your patients, but also for you in the practice, and saving you time when the patient's in there. Now we have all that information in the software, and the patient's in your chair. You can enter all of your diagnostic testing. And this is where we help you fine tune what diagnostic tests you're doing, where to enter that information, how to quickly look at all that information, and then build, that treatment protocol. So the software is now going to analyze all that data, interpret it, give you the risk factors, and give you a predicted diagnosis of what type and severity of dry eye. Once you accept or change that diagnosis, you are now going to be able to build a treatment protocol and a treatment plan for this patient. Once you do that, you can save it, copy it over to your EMR, and then you can also create a great report for the patient that you can email or print off for them. All of that in minutes in a software platform. Next slide, please. So, different assessments. We do have a few different ones for you to choose from. This will show you, it's toggling through it a little bit. We have ones based on Asker's protocol and pre-op. We have the gold standard that's based on the DUES 2 protocol. We've even created a quicker 5-step assessment to pre-screen every surgical patient so that we can truly see if the ocular surface and tear film are ready for surgery. So we do have different assessments. We can customize them to a practice, and we set it up so that it's easy and effective for your techs to add information and for you, the doctor, to add info and data into the assessment. Next slide. Fast, simple, smart. We get to a dry eye predicted diagnosis fast. We get you that interpretation of all the data right before you, all in a platform where you can see exactly what's happening and truly understand what some of those risk factors are and some of the root causes are. Next slide, please. We build a treatment plan report quickly and effectively. We have treatment templates already preloaded. We also make it easy for you just to quickly pick some of those treatment templates or build your own, and we'll help you upload them. From there, too, we made recommendations based on some of that diagnosis as to what are some of the exercises, home therapies, OTC, nutraceuticals, RX options, and of course, procedures like IPL, RF, low-level light. And once we put all this in there, you can quickly edit it, change it, make it your personalized plan for this patient, and then save it and print a report or email a report for the patient. Next slide, please. This was invented by an MD for MDs. And so this was invented by Dr. Al Ghul. And by the way, he happens to be on our webinar today. So we're going to open up some questions, and I hope that he can jump in and answer some of them for you too. These are just a few of the amazing MDs that have been part of even the beta foundation of building this and helping us get the software to where it is. And it's such an impressive invention, and really, something that Dr. Al Ghul has put so much of his own time and effort into. Next slide, please.
Trudy, as you're going to the next slide, how often do you recommend the CSI Dry Eye software be used? Do you use it once to make the diagnosis, or do you follow up afterwards on a repeated basis to monitor maybe your treatment or progression of disease, etc.?
Yeah, it's now open to all questions as well, but it's a great question, Dr. Matosium. And the thing that I love about this software, and I see practitioners really excited about, is the fact that you're building a lifetime of maintenance and information and data for this patient. So we all know right now there's no cure for dry eye. And so what we're doing is teaching that patient right away that we're going to build a baseline in the software. We're going to see where your dry eye is at. We're going to build you a treatment plan and protocol. And then we're going to bring you back in for additional assessments. So where we see the next assessment could be right after they finish, 4 treatments of IPL. It could be where they're, coming in for their annual assessments. So we are building and then comparing assessment over assessment. That is the other amazing benefit of this software, is we can literally put assessments side by side and see what's changing and see what's improving and maybe not improving, declining, and where we need to adjust that treatment plan.
And then a follow-up question is, Mary did a great job of explaining how she had a cash ROI on her investment. Can you go over, Trudy or Dr. Al Ghul, about how you charge patients for this? Do you charge at every interval? Do you have packages? How does it work?
Well, I will let Dr. Al Ghul jump in about how he uses it in his practice. And then I can also jump in at the end and talk about what are some of the real business ROI benefits of this software. So are you on, Dr. Al Ghul?
Yes, yeah. And so I thank you so much for the opportunity, Cynthia, to present. And thanks, Trudy, for doing a great job on this. So, yeah, I mean, there's two aspects to my practice as a corneal specialist who does a lot of high volume surgeries, both in cornea refractive and I guess cornea refractive and cataract surgery. So the two avenues that the software helps us is one in screening surgical patients ahead of time. And we have different sort of software algorithms, one that is fairly quick that we can apply to every surgical patient. It takes very little time and sets sort of the precedence of their overall risk for dryness developing, either having it before surgery and them not knowing, or getting at a higher risk after surgery. And once we sort of decide the level of severity, then we can guide them to doing a more thorough analysis with our dry eye team. And so that's one avenue. And the other avenue, of course, are the referrals coming in for patients who are typically in the moderate to severe category that we're seeing. And it's those patients that we want to be able to do the baseline analysis. And typically we're charging them a combination of things. For example, osmolarity, you could be adding MMP9 and other point of care testing. But we also do charge kind of a baseline fee of about $30 for using the system as a way to kind of interpret and create a report for the patient, and one that we can certainly copy over to our EMR. So, from a ROI point of view, I mean, it pays for itself very, very quickly, and often patients are quite excited to get a baseline report. Sorry, guys. Quite excited to get a baseline report of the dry eye situation. And so, yeah, I mean, I think from an ROI, we typically will charge for somewhere in the ballpark of $30 per patient for that, specifically that aspect of of using the software. And like I said, I can tell you, in our practice, we've been doing it for many, many years, and patients absolutely love the report. And it really helps us set the baseline for ourselves. And it's amazing how many things you miss as a clinician, and not looking at all the data, right? So it really is very efficient way of capturing all that data and setting the right treatment plan, whether it's a surgical patient or a dry eye patient.
And I'll
thank you for answering that. That's really wonderful. And usually when it's a price point of $30, $40, most patients don't hesitate, if it's a much larger amount, they might have to think about it, of course. But I feel the uptake when it's a lower price point like that becomes very effective.
I was just going to add to that, when I'm talking to practices that have been using the software for a while, and I'm asking them, what do you love about the software? What are the benefits you see? The things I hear right away are the efficiency it's creating. It takes less time to document more than you ever have, and to really build, a thorough, detailed assessment. I think the other thing is building that lifetime of comparisons. We have so many patients that drop out of and are non-compliant to some of the treatments. And here we can truly show them and keep them coming back because we're setting that expectation. And the last thing I hear all the time that practices love is that report at the end, because it's justifying if you're bringing, patients back in for a full dry eye assessment, which practitioners are charging, you know, anywhere from 150, 250 for a full dry eye workup. Now you have a report that's almost justifying that price and that cost, and honestly helping you sell those treatments, helping you sell the IPLs and the RFs.